I'm going to give 19 slides, but I'm going to go through them quite quickly. I'm hoping that some of you will already have read the report, which has been out for a few months now, and we will put links in the chat. There is also a very nice infographic which gives all the main data in just a few minutes. So this presentation is based on a presentation that I prepared with Bianca Pilla from the JBI, which was given at the Global Evidence Summit in Prague on the 10th of September. This is the overview of the presentation. Definitions, who we are, HIFA, who we are, the consultation itself, what supporting organisations can do, and acknowledgements of those who've supported this consultation. So just to remind us that when we talk about universal access to reliable healthcare information, we mean a world where every person has access to the information they need to protect their own health and the health of others. And we also have a definition for the global evidence ecosystem, which is described here. It's based on a paper in the Lancet way back in 2004. It is essentially the totality of global activity that is required to meet healthcare information needs. And you can see this if you want to on the HIFA website. We are a global campaign for universal access to reliable healthcare information, and we work by strengthening 3 intrinsic weaknesses in the global evidence ecosystem. The first is communication between the different stakeholders in the system, which we address through HIFA forums. Then the second is understanding health information needs and how to meet them, which we do through HIFA projects. And the third strand is advocacy. So with our advocacy, we encourage relevant organisations like the supporting organisations here today to commit to universal access to reliable health information. As Enoch has said, we have more than 400 supporting organisations, and partly or largely as a result of our advocacy, we have encouraged the World Medical Association to have a policy statement on healthcare information for all in 2019. And IFLA did the same just this year. So this is quite exciting. It means that 2 out of 6 of the main stakeholder groups in the global evidence ecosystem are now committed policy-wise to universal access to reliable health information. We've been going since 2006, and with a steady building year on year with new achievements. And most recently in 2022, we entered into official relations with the World Health Organization. And so this consultation that we held last year is as a result of our collaboration plan with WHO. And in the consultation, it was around 3 main themes. How do you identify yourself within the global evidence ecosystem? How much do you agree or disagree with 11 statements about universal access? And what can WHO do to accelerate progress? We found that 2,410 respondents responded to the consultation from 136 countries, shown in green here. And the representation by WHO region is shown here. So you can see there was particularly strong representation from Europe, Africa, and the Americas, and less so from EMRO, the Eastern Mediterranean, Southeast Asian, and Western Pacific regions. We found that almost everybody who responded identified with one part, at least, of the global evidence ecosystem, so that a particularly large number were people who apply evidence, such as health workers, and there are also a large number of people who generate evidence, i.e. researchers. These are the first 4 statements that we put in the survey, and as you can see, there was overwhelming agreement, strong agreement on all 4 of these statements. We also put up the 7 World Medical Association recommendations to see how strong the agreement was with those. And again, that we found that large numbers agreed or strongly agreed with all 7 WMA recommendations. I won't go through the individual statements for matter of time, but of course you can read all of this in the report and the infographic. Now, we think that the most important single finding of this consultation was that WHO could explicitly champion the goal of universal access to reliable healthcare information. And indeed, this would be the single most important next step to accelerate progress towards universal access. And also that WHO and HIFA could convene stakeholders to develop a global strategy for universal access. And these 2 findings were supported by the Lancet Global Health editorial in September 2024, and they said that they support the championing role of WHO as recommended in the Health Information for All report, and stand ready to play our part in strategy development. Again, I'll put the link to the editorial in the chat shortly. What can supporting organisations do? Well, if you haven't read it already, please do check out the report. We've made a short link to make it easy for you to access it, hifa.org/report. Similarly, we've made a short link for the infographic, hifa.org infographic. We've also recently created a new page called hifa.org/collaborate, which gives background and guidance on 6 ways in which individuals and organisations can collaborate with HIFA. I'd like to acknowledge our sponsors, in particular Oxford Pharmagenesis, who's represented here today by Sophie Nobes, and also the Elsevier Foundation, the National Institute for Health and Care Research, and other sponsors on the right-hand side there. We had really valuable technical support from JBI, IFLA, Costello Medical Consulting, and Stanford University.